What if I told you there's a medication inside your home right now at this very moment that could be silently weakening your heart? I'm not talking about an illegal drug or an experimental medication. I'm talking about something you probably bought at your local pharmacy, over the counter. Maybe yesterday, maybe this week. And here's the thing. You might have been taking this medication for months, thinking it's protecting you, thinking it's helping you, while inside your body the story is very different. I'm Dr. James Carter, a physician with over 18 years dedicated to cardiac surgery. I've operated on hearts in situations most people would never want to imagine. But what I want to talk to you about today isn't the emergencies of the operating room. What truly worries me, what keeps me up at night as a doctor, is what happens long before someone arrives for surgery. It's the silence before the storm. In this video, I'm going to reveal 5 types of extremely common medications that millions of Americans over 60 take every single day, and that science has linked to serious risks for the heart. I'm going to explain why this happens, what to do about it, and most importantly, how to have the right conversation with your doctor, because no decision should be made on your own. But you deserve to have the information. And right here, before we go any further, I need to stop and say something that could genuinely save your life. Every single week in my office, I watch people who are spending thousands of dollars on blood pressure medications, cholesterol drugs, doctor visits, emergency room bills, and they're still struggling. Their blood pressure is still out of control. Their heart is still under attack. Why? Because nobody ever showed them how to support their cardiovascular system from the inside out. That's why when I discovered CardioShield, I knew I had to tell my patients about it. This is a natural formula packed with hawthorn leaf, olive leaf extract, green tea extract, and garlic. Ingredients that science has shown support healthy blood pressure and blood flow. And I'm not talking about theory. I'm talking about the flood of messages I receive every single day from people who tried this and can't stop thanking me. People who were spending hundreds every month on prescriptions and finally broke free with this one small investment. They write to me in tears saying, "Doctor, this is a miracle product. I wish someone had told me years ago." The link is in the first pinned comment below. Go look at it right now before you forget, because your heart cannot wait. It comes with a 180-day money-back guarantee, so you risk absolutely nothing. But you risk everything by doing nothing. Let's begin. First, I need you to understand something. Your heart is an extraordinary pump. Imagine a water pump that works nonstop, 24 hours a day, 7 days a week, 365 days a year, no vacations, no weekends. It beats on average 100,000 times per day and pumps roughly 2,000 gallons of blood every 24 hours. Extraordinary. But after 60, this pump starts working with parts that have a lot of mileage. The muscle gets a bit stiffer, the vessels lose some of the flexibility they once had. And when you add certain medications to that equation, you may be demanding more than this pump can deliver. This isn't theory, it's what I see in clinical practice and what science confirms. So let's go together. The first medication you need to know about is the one found in nearly every home, the anti-inflammatory, ibuprofen, diclofenac, naproxen. They're the first names we think of when back pain strikes, a knee swells up, or arthritis won't let up. Are they effective? Yes. Are they safe for everyone, at any dose, for any length of time? Absolutely not. A scientific review published in major cardiology journals analyzed multiple studies on the prolonged use of these medications and reached a conclusion every senior needs to hear. Continuous use of non-steroidal anti-inflammatory drugs is associated with a significantly higher risk of heart attack, stroke, and heart failure, especially in people with high blood pressure or who have already had a cardiac event. I remember Mr. Harold, 73, a retired man who loved fishing. He came to me with legs so swollen he could barely put on his shoes. He was breathless climbing the stairs in his own home. When we reviewed his history, we discovered he'd been taking diclofenac almost daily for over a year for knee pain. Nobody had warned him it was dangerous. What was happening inside Harold's body was this. Imagine the plumbing in your house. Anti-inflammatories work by blocking substances that protect the blood vessels and kidneys. This causes the body to retain water and salt. It's as if someone started clogging the pipes with sand. The pump, the heart, has to work harder and harder to overcome that resistance. For a young heart, this might be tolerable. For a 73-year-old heart already carrying other challenges, it can be the last straw. And there's another frightening point. These drugs can also raise blood pressure and in some cases completely cancel out the effect of hypertension medication the person is already taking. Can you imagine the seriousness of that? Someone controlling their blood pressure with one medication, taking an anti-inflammatory on their own, and their pressure skyrocketing without anyone understanding why. The golden rule I explain to my patients is simple. If you need an anti-inflammatory for a one-time pain and acute injury, that's fine. The risk is in dose and duration. The problem is daily chronic use without supervision. If you're over 60 and use these medications frequently, talk to your doctor. Ask if there's another option. Sometimes acetaminophen works. Sometimes a topical anti-inflammatory gel that acts only at the point of pain without entering the bloodstream is much safer. That conversation can make an enormous difference. But wait, because what comes next will surprise many people. We're talking about a medication people associate directly with protecting the stomach. The second medication I want to bring to you is omeprazole, and its cousins, pantoprazole, esomeprazole, lansoprazole. They're called proton pump inhibitors. If you're over 60, it's very likely that either you or someone in your family takes one of them every morning on an empty stomach. Omeprazole is the second best-selling medication in the world, created for 4 to 8 week treatments to heal ulcers, treat serious reflux. It became a daily companion for millions, and that's the problem. The FDA issued clear warnings. Prolonged use of proton pump inhibitors for more than 1 year can cause a significant drop in blood magnesium levels. And here I need to stop and ask you, do you know what role magnesium plays for the heart? Magnesium is like the conductor of the heart's electrical orchestra. It regulates cardiac rhythm. When it drops, the heart starts losing its beat. Arrhythmias appear, those sensations of the heart skipping, beating too fast, or beating irregularly. In more severe cases, the consequences can be serious. Mrs. Margaret, 68, came to me complaining of a strange sensation in her chest, as if her heart would pause from time to time. She'd been on omeprazole for 2 years, self-prescribed for her sensitive stomach. We ran tests and found her magnesium had plummeted. We adjusted the medication, supplemented the magnesium, and within weeks her heart returned to normal rhythm. The scare, fortunately, ended well. But there's something else that concerns me. Observational studies published in Circulation from the American Heart Association signaled a possible association between prolonged use of proton pump inhibitors and increased risk of cardiac events. Researchers believe this may happen because these substances can reduce levels of nitric oxide, a molecule that keeps blood vessels flexible and healthy. When nitric oxide drops, vessels become stiffer, and stiff vessels are fertile ground for heart problems. And it doesn't stop there. If you've had a heart attack or had a stent placed and take clopidogrel, you need to know. Omeprazole can weaken the effect of clopidogrel. It can leave you less protected without anyone noticing. The message isn't to throw omeprazole in the trash. For those with a real indication, it's extremely important. The message is, if you've been taking it for more than a few months, ask your doctor if you still need it. Ask them to check your magnesium levels and evaluate whether there are alternatives or a lower dose. Before continuing with the next 3 medications, I want to take a quick pause. If you've made it this far, you already know this information is important and powerful. So I ask 2 simple things. First, subscribe to this channel. Second, share this video now with someone you love, with that person who takes medication every day and deserves to know this. 1 share can change a life. Thank you. Let's continue. The third medication might seem the most innocent of all. It's the one you buy when your nose is stuffed up. Oral nasal decongestants. Pseudoephedrine, phenylephrine. They're in dozens of cold products sold freely at any pharmacy. Mrs. Dorothy, 71, a retired teacher, caught a bad cold, bought a cold medication with a decongestant so she could breathe and sleep. On the 3rd day, she arrived at the emergency room with blood pressure at 210/130, a hypertensive emergency, and with her heart in arrhythmia. What seemed like a simple cold remedy had become a real threat. Pseudoephedrine is a vasoconstrictor. Its job is to narrow the blood vessels in the nose to reduce swelling. The problem is it doesn't stay in the nose. It travels through the blood and narrows vessels throughout the entire body. It's like squeezing a garden hose with the faucet on. Pressure surges and the heart has to pump against much greater resistance. For seniors with hypertension, heart disease, or simply a heart with over 6 decades of work, this stimulation can be dangerous. The good news is there are much safer alternatives. Saline nasal spray, local use corticosteroid sprays, room humidifiers. Next time you're at the pharmacy with a blocked nose, read the label before you buy. And this is where things get even more serious. We've arrived at the 4th medication. mental health, and the heart. Depression, anxiety, and insomnia are very common after 60, and treating these conditions is essential. But there's a class of older antidepressants called tricyclics, like amitriptyline and imipramine, that are still used with some frequency. What most people don't know is that these medications can directly interfere with the heart's electrical system. Imagine the heart as a house that depends on perfect electrical wiring to function. Each heartbeat begins with an electrical impulse that travels through the heart in milliseconds. Tricyclic antidepressants can delay this electrical conduction. This increases the risk of dangerous ventricular arrhythmias. Additionally, one of the biggest threats for seniors taking these medications is orthostatic hypotension, the sudden drop in blood pressure when standing up. Mr. Frank, 76, was taking amitriptyline for diabetic nerve pain. One morning, getting up to go to the bathroom, he fainted and fractured his hip. That fall completely changed Frank's independence. Today, there are much more modern antidepressants with far better cardiac safety profiles. If you or someone in your family takes medication from this class, it's well worth discussing with the doctor whether it's still the best available option. And we've arrived at number 1, the most surprising medication of all, the one that millions of Americans take thinking they're caring for their bones. I'm talking about calcium supplements. Calcium carbonate, calcium citrate, those tablets that women especially take to protect their bones after menopause. A meta-analysis published in the British Medical Journal analyzed 15 randomized clinical trials involving nearly 13,000 patients. The conclusion was disturbing. Patients taking calcium supplements showed a 27 to 31% increase in the risk of heart attack compared to placebo. The multi-ethnic study of atherosclerosis, funded by the National Heart, Lung, and Blood Institute, followed participants for 10 years and observed that calcium supplement use was associated with a 22% higher risk of coronary artery calcification. It's as if the excess calcium that can't make it to the bones ends up depositing on artery walls, hardening them and setting the stage for a heart attack. The calcium you eat in cheese, yogurt, and dark leafy greens reaches the body gradually. The calcium pill creates a rapid, concentrated spike. The body can't use it all at once, and the excess has to go somewhere. I remember Mrs. Patricia, 72, who was taking 2 calcium tablets per day on her own without ever having requested any tests. Tests showed elevated blood calcium and concerning arterial calcifications. She was trying to protect her bones and putting her heart at risk without knowing. You've made it this far, and now you have information most people don't. So let's organize what to do starting today. Never stop any medication on your own. Become an informed and active patient. Before your next appointment, make a list of everything you take. Bring that list to the doctor and ask concrete questions. Take care of your nutrition. Calcium from dairy and dark leafy greens, magnesium from nuts, seeds, beans, dark chocolate. And before I close, I need to come back to what I told you at the beginning of this video, because now you understand why it matters so much. Everything I talked about today, blood pressure spiraling out of control, magnesium crashing, blood vessels hardening, the heart being attacked from every direction. All of this comes down to one thing. Your cardiovascular system is under siege, and most people are doing nothing to support it from the inside. That's why CardioShield isn't just another supplement to me. It's the one thing I've seen make a real, measurable difference in people's lives. Hawthorn leaf to support the heart muscle, olive leaf extract for healthy blood flow, green tea for antioxidant protection, garlic to help maintain healthy pressure, all working together naturally. The messages I get are not just thank yous. They're people crying with relief. People who spent years throwing money at prescriptions that weren't working, who finally found something that actually supported their heart the way nature intended. They call it a miracle product, and honestly, when I see the results, I understand why. The link is in the first pinned comment. You have a 180-day guarantee. You have 0 risk. But every day you wait, your heart is working without the support it deserves. Don't do that to the organ that has never stopped working for you. Go check it out, right now. There is no harmless medication. There is no supplement without an effect on the body. Everything that enters the body has an action. And in a heart with over 60 years of hard work, every detail matters. Your heart is beaten for you every single day of your life, without complaining, without stopping, without asking for anything in return. Take care of it with the same dedication it takes care of you. Share this video with someone you love. Subscribe and turn on notifications. I'm Dr. James Carter, and I'll be here every week to help you understand what's happening inside your body. Take care of your heart.